Welcome to the Explainer. There are a lot of skills you can learn in life, but today we're talking about maybe the most important one there is, how to save a life. Okay, let's just get right to it. In an emergency, every single second counts. Seriously, the time between something happening and paramedics arriving, that's a make or break window. And what you do in that window can literally be the difference between life and death. Yeah, there's actually a name for this. Medics call it the golden hour. Now, it's not always exactly 60 minutes, but you get the idea. It's that critical period where getting the right help has the biggest, most positive impact. And you're the one who can kickstart that whole process. All right, so where do we start? Let's dive into one of the most common and, frankly, scary situations, a cardiac emergency. The first thing we need to do is know what it even looks like. So think of the heart like a super complex pump. A cardiac emergency is what happens when either the plumbing, the blood flow, gets blocked, or the electrical system that tells it to beat just goes haywire. This can be a heart attack, or it can be a full-blown cardiac arrest, which is when the heart just stops. Okay, so what are the telltale signs? Well, the one everyone knows is that crushing chest pain, right? People literally describe it like an elephant is sitting on them. But, and this is super important, it's not the only sign. You've got to look for pain that kind of spreads, maybe to the jaw or the left arm, or sudden crazy sweating, or someone just gasping for air. Seeing these signs, that's your cue to act. Okay, you've seen the signs, you think this could be serious. What's next? Well, now we assess. And listen, this isn't about you playing doctor, not at all. It's just about figuring out what you need to do, like right now. And here it is, the first and most important question you have to answer. Is this person a wait? Are they with us? You just gently tap them on the shoulders and shout, "Hey, are you okay?" How they answer, or if they don't answer at all, changes everything. The pros have a really slick little tool for this. It's called the AVPU scale. It's super simple. A is for alert. V is for responding to your voice. P is for responding only to pain. And U is for unresponsive. And believe me, if you're anywhere past V, you are in a major emergency. And that leads us right to the absolute foundation of all first aid. I'm talking about the ABCs. It's so simple, but so crucial. First, airway. Is it open? Can air get in? Second, breathing. Are they actually breathing? And third, circulation. For us, that just means, are they bleeding badly? This quick check tells you everything you need to know to get started. So what if the answer to those questions is bad? What if they're unresponsive and they're not breathing normally? That's when we get to the single most important thing a bystander can do, CPR, cardiopulmonary resuscitation. Okay, CPR. We've all seen it on TV, right? It looks intense, but what is it really? The idea behind it is actually incredibly simple. Think about it. When someone's in cardiac arrest, their pump, their heart, has just stopped working. It's not moving blood anymore. When you do CPR, you become their heart. It's that simple. Your hands are literally pushing that life-giving, oxygenated blood to their brain and their organs, keeping them alive until help can take over. Yeah, people in the field talk about something called the chain of survival, and you can see every link here is absolutely vital. But look at the first two, recognizing what's happening and calling for help, and then starting CPR. That's you. You are the first, most critical link in that chain. Without you, the chain is broken before it even starts. All right, let's get into the step-by-step. But before you do a single thing, and I mean anything, you have to check the scene. Look around. Is there traffic? A downed power line? A fire? You are no good to anyone if you become a victim too. Your safety is always, always priority number one. Okay, scene is safe. Next, you do a quick check for breathing. Is their chest rising and falling? And I mean quick. You only have about 10 seconds for this. If they aren't breathing, or if they're just making these weird gasping noises, it's time to go. And hey, quick tip. Don't waste time trying to find a pulse. It's hard to find under pressure, and it just eats up precious seconds. No normal breathing? Start CPR. Next up, call for help. And listen, don't just shout into the air, "Somebody call 911." You know what happens? Everyone just stands there thinking someone else will do it. No, you have to be direct. Point at one person. You, in the blue jacket. Call 911 right now and come back and tell me they're on the way. By giving a specific command, you make sure it actually happens. Now we get to the compressions. The rhythm is everything. You're aiming for a speed of 100 to 120 compressions every minute. Now, how are you supposed to know what that feels like? Well, there's a trick. You just have to push to the beat of the song Staying Alive. Seriously, it's the perfect tempo. So here's how you do it. Heel of one hand right in the center of the chest. Other hand on top, lace your fingers. Now walk those elbows straight. Get your shoulders right over your hands so you're using your body weight, and then push. Push hard and push fast. You're going down at least 2 inches. And just as important, let the chest come all the way back up after each push. That's what lets the heart refill with blood. Okay, what about rescue breaths? If you've been trained and you're willing to do them, you first have to open up the airway. It's easy. One hand on the forehead, tilt the head back gently. Then use your other hand to lift the chin. This little move pulls the tongue out of the way and gives you a clear path for air. So the rhythm is super simple to remember. 30 compressions, then 2 breaths. Over and over. 30 compressions, 2 breaths. But, and this is huge, if you haven't been trained or you're just not comfortable doing the breaths, that's okay. Just do the compressions, nonstop. Hands-only CPR is incredibly effective and it absolutely saves lives. The main thing is, don't stop. You keep going until the paramedics get there and physically tap you on the shoulder to take over. Okay, that was a lot of information, I know. So let's wrap it up with a super simple guide. A final briefing on the big do's and don'ts. Because in a crisis, sometimes just remembering a few key rules is what gets you through. Let's start with what not to do, because this is just as important. First, don't let someone tell you they're fine and try to push through it. Denial is a real symptom. Second, absolutely do not let them drive to the hospital. And if they're having a hard time breathing, don't make them lie down flat. That can actually make it way worse. Help them sit up instead. And the do's? These are your power moves. Number 1, call for help immediately. Don't wait. Number 2, get the person to stop whatever they're doing and just rest. 3, do your best to keep them and yourself calm. And 4, loosen anything tight, like a collar or a tie. See? Simple things, but they can make a huge difference while you're waiting for the pros. So there you have it. You've seen the what, the why, and the how. The steps aren't complicated, but the impact, well, it's about as profound as it gets. That ability to step in, to be that first link in the chain of survival, that's in your hands now. The only question left is, are you ready to be a lifesaver?